got registration and licensing, and that isn't it, is it?
Personnel.
Personnel, it should be, but it's got a registration and licensing. It's all this new system. Just to make you all aware, today's meeting will be recorded, and can I remind you all to switch your phones to silent for the duration of the meeting. And I also refer you to the protocols for remote meetings, which have previously been circulated. Namely, your microphone should be switched to mute unless you're speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand? And I will assume that you've all read the paperwork before us today prior to the meeting. And please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. I did have a problem with the hand function the other day, so I'm sure Nadine will keep her eye on that, or Sheena will. Right, when asking a question, can you please indicate which page number you're referring to as well, please? The first item on the agenda is to do a roll call. I am Councillor Doreen Jones, the chair, and I am present. I will now call on Deneen, the Democratic Services Officer, to take the roll call. Okay, Deneen.
Thank you. Councillor Dean Causey.
Present.
Councillor Stop Amsey.
Present.
Councillor Sharon Freegard.
Present.
Councillor Joe Hale.
Present, thanks.
Councillor Nigel Hunt. Councillor Jane Jones.
Present, Nadine.
Councillor Simon Noyle.
I'm here, thanks, Nadine.
Councillor Ted Latham.
Yeah, I'm here, Nadine, thank you.
Councillor Sandra Miller.
Present.
Councillor Anthony Taylor.
Present, Nadine.
So you got Councillor Carol Clement Williams.
Present, Nadine.
Councillor Leanne Jones. Councillor Alan Lockyer.
Present, Nadine.
Councillor Peter Rees.
Present, Nadine.
Councillor Peter Richards.
Present.
Councillor Annette Wingrave.
I think Annette should have given apologies, Nadine. She's not attending today.
Okay, thank you. Sheena Rees.
Present, Nadine.
And Diane Hopkins.
Present, Nadine.
And that's it. Is there anybody else I've missed out?
Sorry, can I give Nigel Hunt's apologies as well, please?
Yeah, no problem.
Thank you.
Okay, thank you. That's it, Councillor Jones. Thank you.
Okay, thank you very much. Declarations of interest. Are any members, please indicate whether you have any declarations. No, I don't see any. Okay, the next item on the agenda then is the Workforce Information Annual Quarterly Report. And I take that it's Sheena Rees is doing that. Sheena?
Thank you, Chair, and good afternoon, everyone. So this report is the Q4 report for 2019-2021, apologies. So this is a factual position statement as at Q4 of that year. I've set out headline data in the cover report, so I don't have anything to add to that, Chair, but I'm happy to take any questions.
Thank you for that, Sheena. Are there any questions? Carol?
Yeah, just Sheena, on page 5, it says no financial impact. Shouldn't that be what the cost of the sickness absence should be?
Okay, hold on. Sorry, I'm toggling between screens.
I hate this new system.
Yeah, the financial impact refers to the report itself, So the report covers a broad spectrum of data in relation to the workforce, and we have included some of the employment costs within the report. I haven't included the costs of sickness absence data, but I can get you that figure if you want the costs of sick pay for the year.
Yes, please.
Okay.
Thank you for that. John?
Thank you, Chair. Thank you, Sheena.
John?
Yes, Sheena, I can see that the absence has decreased this year. Is the reason because more people are working from home?
I think there's going to be a number of factors. So clearly one factor is going to be that a significant portion of our workforce were working at home, but actually a larger proportion of our workforce continued to go into workplaces. So it's only one factor. We also think that the increased hygiene levels that have been introduced have had an impact on things like the normal coughs and colds that normally spread throughout the workforce every year. So we haven't seen that kind of trend. So things like normally you'll get regular winter vomiting sickness. That didn't impact on us over the past few months. So that's got to have a link to increased hygiene. There are interesting trends in relation to the workforces who continue to go into the workplace. And this is only anecdotal evidence, but we actually think that the workforce have been so committed that sickness absence rates have been the lowest that they've ever been. So within services like home care, for instance, the workforce have really turned up. So we think there's a number of factors have led to the very low sickness absence rates that we've had over the past year.
Thanks.
Did I see Councillor Bams' hand up? Scott?
Yeah, thank you, Chair. Thank you, Chair. It's pleasing to see that levels are dropping. I've noticed that stress related and sort of depression that is still quite high on the charts. Are we doing anything more to perhaps look at early intervention to see the early signs with our colleagues? I know we've got a good policy in place for the mental health, but as Councillor Hale pointed out, people who are working from home now, so possibly with that less contact, we'll less likely to see the signs. If people are suffering mentally, and working from home brings its own challenges itself for people with where there's loneliness, or perhaps some people are trying to work at home with kids running around the house. It brings its own sort of new type of stresses that we're not used to. So have we kind of factored that into kind of preventing future stress related abscess? Cheers.
Thanks for that question. And actually, it's a really important point about the mental health of our workforce, and it's been a key priority for us, both before the pandemic. So prior to the pandemic, the council signed up to Time to Change Wales. Diane, who's on the call today, Diane has very much led on putting in place an action plan to support us with our employer pledge on Time to Change Wales. You'll know that we don't like to pay lip service to things, so we've taken the employer pledge very seriously. Diana's worked very hard with Time to Change Wales to put in place a number of meaningful actions, and actually that's really supported us as we've gone into the pandemic. So we'd put in place a number of things, and actually we've really been able to develop that during the pandemic. We've had a number of resources available online. And that's been a range of things from guidance, toolkits, focusing on different mental health problems. So we've had a section on bereavement, we've had a section on children's mental health, we had a section on homeschooling. The school counselling service ran a hotline for parents and staff in schools to help them with any questions they might have had around children's mental health. Something that Diane has worked on has been to put in place a network of employer champions on mental health. So that's our own employees who have attended training with Time to Change Wales, and who can really champion talking about mental health. The training team have put on a wide range of training. So something that's been really important has been the mental health first aid, and we've had hundreds of employees have attended that now. So that we've done a lot around mental health. It's a very important area for us to keep plugging away at. When we come to the next report on the workforce plan, there's a lot of actions are contained within the update to that action plan in relation to mental health. I'll just check with Diane whether there's anything else Diane wants to add to all of that. It's probably a subject we could talk about all day, to be honest.
No, I think you've covered everything, Sheena. It's just to say, really, that all these resources that Sheena's been referring to, they're available on the internet. So whilst all our office staff can access the intranet, we've made them available for our external facing network, so that if people don't have access during work time, they've all been able to access them, you know, on their smartphones, laptops, whatever they've got. So it's not just for people in the office, it's for everyone across the authority.
Oh, that's great to hear. Thank you very much.
Chair, both Councillor Hale and Councillor Carol Clement Williams and Councillor Peter Richards are indicating.
Yeah, I've got them. Carol?
Yeah, I'd like to thank Scott for asking that question. It's made me think about some other things. The time to change Wales stuff are very much welcomed. You're saying that, you know, it's making a difference, but how are we measuring that? Has there been a survey of staff as to, you know, what differences they may have seen and that kind of thing? Because unless we can measure it, I don't think we can actually say how much of an impact that's having. The employer champions, is there a councillor who's won? Because there's a lot of this stuff about the courses, mental health first aid. How many of these have been pointed out to councillors, and how many councillors have attended? I don't recall seeing, I know you're saying this on the internet, but we're all very busy and very often things slip by you. I haven't seen emails to councillors saying, if you're interested in this mental health course or whatever, here's the link. So I just want to flag up that don't forget us either. Thank you.
Right.
Do you want to come back on that, Sheena?
Yes, please. Thanks, Chair. Right, so there was a number of points there, so I hope I cover all of them. In terms of the employee survey, we've just carried out a survey of our office-based staff who have been home working during the pandemic. So that survey has just closed, and we included a section in that around mental health. Asking employees whether or not they were aware of the resources that we'd made available, whether or not they'd had regular communication with their line managers, whether or not they'd attended team meetings. So a range of questions about the mental health. That survey has just closed. So we're going to be looking at the results from that, and we'll be able to provide you with further feedback.
Sheena, if I may, how many councillors did you survey?
No, that was an employee survey. So that was for employees who normally are office-based but who've been home working. There has just been a member survey carried out. I can't talk to you about that because I believe that was issued by Democratic Services. But I understand that survey has just closed or is imminently closing, and the results of that will be shared with the Democratic Services Committee to consider and take on board. So I understand that councillors were asked a number of questions about their mental well-being within that survey. I haven't been privy to it myself, so I don't know the detail of that survey. I met with the project team that sit under the recovery board this morning. So we've surveyed office-based employees. Next, we want to issue surveys to employees who've continued to go into workplaces. And so we're going to issue that survey imminently and ask a set of questions around how well supported they have felt, whether they're aware of the resources, how their mental well-being is. So we've done part of the workforce and we're going to follow up on the rest of the workforce. So that's in relation to the survey. Does that address that part of your question, Councillor Clement-Williams?
I don't recall filling in any surveys.
Yeah, it has, Carol. I filled them in myself.
Oh, I missed
We did get one. I mean, you know, I think we've got to realise that everybody's, like you've just said now, everybody is so busy. I think they're busier doing this actually than we were when we were going, because you're given a chance to talk to one another, which is, you know, which is what's missing really, isn't it?
Okay,
Do you want to come back? Oh, sorry.
Oh, can I just follow up on the other part of Councillor Clement-Williams' question, which was in relation to whether or not councillors have been made aware of the resources. That's something I'll pick up with my Democratic Services colleagues, because to be honest, I don't know what's been circulated to members, but there is a point in there. So this is something, again, that we were talking about in the Recovery Board project team meeting, is we want to get some very clear messages out to employees and councillors about the resources that are available to make sure that everyone is aware of them. I think that's a really important point. We are all really busy, so sometimes it's really hard to find time. You know, we've produced some fabulous guidance, but you're not necessarily always going to have the time to read through the guidance. So we're linking in with the comms and marketing team to distill some of our guidance into very short, sharp messages, and that will be rolling out over the next few weeks. So hopefully, if you're not aware of the resources available, hopefully we'll start pushing that out more and you'll start seeing it more. But we can certainly circulate the link to the mental health resources to all of you on this committee after the meeting today, if that would help.
I think it might be worth passing it on to all councillors so that they have a chance to go in and have a look at it. Thank you, Sheena, very much.
No problems.
Thank you, Chair.
Joanna?
Yes, I agree with what Carol has just said. I think that, you know, councillors have all had to work from home as well, and lots of them are suffering with, you know, not going into work, or, you know, so I think we need support also. It would be nice if we could have access to the training, because everybody has got different levels of, you know, mental health, and it would be great if we could be aware of all this as well. Thanks.
Chair, if I could just say these issues I will refer to the Democratic Services Committee. Obviously, this committee is the Personnel Committee and it's about the workforce of the council. I think there's some really important points that are being made about elected members, and I'll refer that to the Democratic Services Committee to have a look at.
Thank you for that. Peter Richards?
Thanks. I don't want to dwell on this particular subject, but what it evidences to all of us, I suppose, and to me, is the importance of supervision. And I think the difficulty we've had with supervision since the lockdown, specifically in my portfolio, has been a challenge, and people are now suffering through exhaustion, for want of a better word. So I know obviously the PIs will reflect that when they come through, you know, won't they? So, but you know, we've always been sort of passionate about supervision in social services, but this definitely highlights it big time, more than ever, I think. So thanks.
Thank you for that, Peter. Are there any other comments before I move on? This item is for information, and the recommendation is on page 6 of your minutes.
Chair, there's a comment on the chat box from Nigel Hunt.
Oh, does anybody want to comment on that?
I don't really know what agenda item is under, Chair.
I can't even see.
Pay policy, we are told it's 44%, so we'll leave that until the relevant information. Is that relevant to this report, Sheena?
Yeah, it is actually. So it is data that we've included in this report. The data for this report will have been produced at a different time to the pay policy statement. So I'm going to have to go back to the Workforce Information team and ask them for the explanation why there is different data. So I can do that, and I'll certainly let you know, Councillor Hunt.
Okay. Well, yeah, you can let us all know and circulate it to everybody.
Okay.
Thank you for that. Are there any other comments or questions before I move on? Do we all accept the recommendation? It's for noting anyway, it's not for decision, on page 6. And I'll move on then to item 4 on the agenda, Sheena again, which is the workforce plan action.
Okay, thanks, Chair. So this is the annual report in relation to the Workforce Plan Action Plan. The Workforce Plan is in place for the year 2018 to 2022, so for a 5-year period. This report relates to the year 2020-21. We have fed back on how we've performed in relation to the actions set out in the action plan. And despite the pandemic, actually there has been a huge amount of activity. What I've set out in the cover report, and I won't repeat the things that are in the recover report or in the action plan, but what I would emphasise is that our workforce planning processes actually proved to be incredibly helpful to us when it came to the pandemic response. So one thing that I've highlighted are the processes that we already had in place to support redeployment in the council, and that's something that we worked hard at over a number of years, focusing on avoiding compulsory redundancies. We're very good at it in this council. We redeployed in excess of 1,000 members of staff over the decade, avoiding their compulsory redundancy. But those processes then became incredibly useful when it came to responding to the pandemic. So where we had large numbers of staff who weren't able to attend their normal workplace at the beginning of the pandemic, who weren't able to work at home, we were actually able to use those same redeployment processes to actually redeploy those staff to doing activity that would be useful to the pandemic response. So to the Safe and Well service, to the food hub, and particularly to the TTP team. So our workforce planning processes that we've established over the years and in this plan actually really helped us. One thing I would also like to pay tribute to are the teams led by Diane, Sean Burgess, Lynn Doyle. So small teams, but actually the activity in the Workforce Plan Action Plan is these small teams that have made all of this happen. During the pandemic, they've mainly been working at home, occasionally going into offices when it's been necessary, and they haven't hesitated to do that when it has been necessary. But actually, they've really punched above their weight, they've gone the extra mile, and they've really supported the pandemic response. So I'm happy, it's a very long report. It reflects all of the activity, and I'm happy to take any questions, Chair.
Thank you for that. I think we've got to remember as well the schooling floods and the workforce that had all that. It's not just the pandemic. I think there's been a lot of things over the past 18 months that the staff have had to deal with, and they've come up with flying colours, every single one of them. And I think that we should be congratulating all the staff on that.
You've gone on to me, Doreen.
Sorry, Carol.
I'd just like to second what Sheena has just said, to be honest. The staff have completely impressed me. They've worked so very hard. I just sometimes I feel for them when there's negative things put on social media, and because it's those people very often that they're criticising, and it's really disappointing to them. And I know this because I've spoken to some. They get very downhearted sometimes when the press isn't, or either the press or the comments are negative. And I, for one, take every opportunity I can to thank them. I think they've done an amazing job. They've gone more than the extra mile. They've probably gone the extra 1,000 miles. Yeah. So personally, I think they've done a fantastic job. Thank you.
Thank you for that. Anyone else want to make any comment or ask a question? I can't see any. Well, the recommendation again is just for information on page 22 of your.
Gone back on mute again, Doreen.
It's this little hand keeps whittling about. Right then, we're going on to item 5 now. And who's doing this one? You again, Sheena?
Yeah, I haven't got a lot to say, Chair. So again, this is a factual position statement report. It provides the gender pay gap data for 2020. It shows that our gender pay gap is closing, so that's good news. It shows that all the work that we've put into the Gender Equality Action Plan is starting to pay off. One thing I would just highlight, it's in the cover report, but we have provided the comparison data with the national average. So in April 2020, our median gender pay gap was 3.44%. And if we compare that with the UK national average of 15.5%, that gives an indication of how well we're doing. So happy to take any questions, Chair. You're on mute, sorry.
Yeah, I've got it back. Are there any questions or comments? Are we all happy with that? That's for information, and that again is on page 51. If you're happy with that, we'll move on to the next item on the agenda. And are you taking this again, Sheena?
This is the coronavirus vaccine policy. Diane has developed this policy in partnership with the trade unions. It very much is setting out the council's commitment to the national vaccine programme and seeks to remove any barriers to employees attending their vaccination appointment. Diane, do you want to add anything to that?
Not really, Sheena, only to say that it was developed with best practice from ACAS and the CIPD, and it has been approved by the trade union, so they were very supportive of it.
Okay, are there any comments or questions, or Sharon?
Yeah, I just wanted to ask, do we know how many people are not being vaccinated? How many have actually chosen not to take up the vaccination? I can see that, you know, you've said about sensitivity to employees who have some issues, but I wondered what the figures were, if we had any, Sheena.
We don't have that information.
Okay. Okay. Carol?
Yeah, thanks. I don't think we're not allowed to ask them if they've had it, because that would be, you know, privacy. But in there you've mentioned that that they're paid if they're off with the effects of the vaccine. But do we exclude, say they took 3 days off with effects of the vaccine? Do we exclude that from any sort of you know, adding up of time off sick towards interviews and things like that?
Yeah.
Because if we are good, if not, we should.
Yeah, we don't include it in sick pay because basically we don't want anything that would influence somebody's decision to go and have the vaccine or not.
Okay. Are there any other comments on that?
Can I come back, Doreen,
Yeah.
on that point?
Yeah.
Why, taking up Carol's point, because obviously there are data protection issues in there. Why does it say in the paragraph that they need to discuss it with their line manager if they're not taking it up? Have I misread that?
No.
Yeah.
Oh, sorry. Go on, Diane.
They're only to discuss with their line manager if they have concerns around having the vaccine. It's not for their line manager to tell them to have it or anything. If they want to and they've got concerns, they are able to discuss it with their line manager.
Right, okay. Thank you.
Are you happy with that? Yeah. Well, there is a recommendation on page 62 for approval. Can I have a proposer and seconder, please?
I propose, Chair.
Thank you. Seconder?
I'll second, Chair.
Thank you very much. All approve, obviously. Yeah. There we are. Thank you very much. And then we go on then to item 7, which is a review of the recruitment restrictions. Okay.
So Chair, this is a proposed slight relaxation in restrictions that we introduced a decade ago. And we introduced those restrictions to safeguard employment at a time where the council was facing a very difficult financial position. There were concerns around compulsory redundancies. So the recruitment restrictions were part of a suite of measures that we agreed with our joint trade unions. We don't have the big numbers of staff who are at risk of redundancy anymore. So we're proposing to relax our restrictions, really so that we're not creating any unnecessary delays in the length of time it takes to recruit staff for very little benefit when we don't have people, lots of people at risk of redundancy. It's something that we propose to keep under review. So if it looks like the numbers of those at risk are creeping up again, then we may review the restrictions and tighten them up again. We've discussed this with the trade unions. They are comfortable with this, they're supportive of it. So happy to take any questions, Chair.
Thank you for that. Are there any questions or comments? I don't see any. The recommendation for approval is on page 82. Can I take that as approval? Yeah, thank you very much. The next item on the agenda is urgent items. I don't have any. And item 9 is access to meetings. We are now going into the private items, access to meetings, that pursuant to section 100A bracket 4 and bracket 5 for the Local Government Act 1972, the public be excluded for the following items of business, which involve the likely disclosure of exempt information as defined in paragraphs 12 and 15 of part 4 of Schedule 12A of the above Act. Can I check that the recording has stopped and the press and public have left the meeting?
I've stopped recording now, okay?
Thank you.